This is the Community Health Assessment for Allegheny County, Pennsylvania for the University of New England by Lydia Hartzell. For those of you who don't know where Allegheny County is located, Allegheny County, Pennsylvania is located on the western side of the state of Pennsylvania and includes the major city of Pittsburgh. To begin the health assessment, I will review the windshield survey observations. The windshield survey had a boundary of a local suburban community along Route 19. The housing was off the main road, and houses were older but well kept. Local businesses were on either side of the road. Some of the businesses included bakeries, hair salons, restaurants, banks, and small clothing stores. Businesses changed from locally owned to high-end corporations as Route 19 approached the city of Pittsburgh. For example, a certain area along Route 19 had higher-end department stores and organic grocery stores. 2 parks were observed in the suburban communities with flyers for local events. The landscape changed upon reaching the city of Pittsburgh. There was no public transportation observed in the suburban community, but public transportation was available in the city of Pittsburgh. These findings from the windshield survey were supported by the interviews with local community leaders. The first interview was with the director of the Jewish Community Center, JCC for short. The JCC has a campus in the southern end of Allegheny County and a campus in the heart of downtown Pittsburgh. The JCC serves a community of some 10,000 Jewish members in the southern campus alone, and provides programming and education to the community. As noted during the interview, a large part of the JCC's programming involves partnering with community agencies such as schools and libraries to further its reach in the community and bring people together. The director of the JCC did not identify a particular health concern for the community, but rather noted that the community was aging in place and needed programs to support a healthy lifestyle. The second interview was with the Senior Director of Clinical Affairs and Business Development for the University of Pittsburgh Medical Center, UPMC, Health Plan. This interview revealed a concern that healthcare is experienced differently across populations. There is particular concern with how social determinants of health affects healthcare access. The Senior Director relayed that for patients who are unable to afford their electric bill, money would first go to the bill, and then, if anything is left over, they might consider purchasing their medications. In an effort to address health disparities such as these, the organization and the Senior Director work on programs that will prevent disease and disability, manage chronic diseases, reduce hospital admissions, and increase the quality of life. The interviews revealed 2 different concerns for the community's health. However, these outlooks support the overall assessment and findings of a diverse community. Continuing with the assessment, Allegheny County is the second largest county in Pennsylvania. It is home to a diverse population with varying racial background and socioeconomic statuses. Allegheny County is located in southwestern Pennsylvania and covers 730 square miles, accounting for 1.6% of PA's total land area. Allegheny County has a population of 1,223,048 people based on the 2010 census estimates. The median age for Allegheny County was 41 years old, with the female population at 51.7% and the male population at 48.3% in 2017. Allegheny County remains primarily white population at 80.3% as of 2017. You can see the breakdown of races in this figure to the right. In addition, the median household income from 2013 to 2017 was $56,333. In Allegheny County, it has 12.5% of its population living below the poverty level between 2013 and 2017. At this point in the assessment, we will begin the MAP process. For this assessment, I employed 4 of the 6 phases of the MAP process. Each of the phases was selected to allow a thorough assessment of the community and establish public health initiatives. The health profile of Allegheny County was found to be similar to its nearby counties in the state of Pennsylvania. Allegheny County had a cancer incident rate of 491.0 cases per 100,000 people between 2011 and 2015. The incidence rate has maintained a steady decrease because the rate was at 505.1 per 100,000 in years prior between 2003 to 2007. In addition, between 2009 and 2010, 11.0% of the population in Allegheny County had diabetes. This is higher than both the state, which is at 10.3%, and the U.S., which is at 10.5%, although not by much. Allegheny County ranked higher than the state for incident rates of gonorrhea in 2017, with 146.7 per 100,000 people. And finally, Allegheny County has a history of poor air quality based in its coal and steel history, which played a role in child asthma rates. They were at 10.8% between 2016 and 2017. This percentage of students grade K through 12 diagnosed with asthma was lower than the state, which was at 11.9%. However, the trend is moving upward. Taking into consideration the demographic and health profiles, as well as Hanlon's method of prioritization, it was determined that the health priority for this assessment to be child asthma. Allegheny County is in the heart of the Rust Belt. The community history is steeped in coal mining and steel production, and especially within the city of Pittsburgh, that is true. As reported by the State of the Air 2019 report, Allegheny County received an F for ozone health, an F for particle pollution 24-hour health, and failed the particle pollution annual health review. Unhealthy ozone and particle pollution levels negatively impact individuals diagnosed with asthma, as well as increase the risk of developing asthma. Based on the Pennsylvania Behavioral Risk Factor Surveillance System, 10% of Allegheny County's children were diagnosed with asthma in 2011. Allegheny County has an estimated 227,850 children, according to the 2010 census, and of that total number of children in Allegheny County, approximately 22,785 children suffer from asthma. Moreover, it was found that asthma diagnosis is more likely among African American teens. This disparity could result from living in areas where particulate matter pollution is much worse than other areas. Moving on to the community assets step of the MAP process, Allegheny County is home to two major health systems known as UPMC and Allegheny Health Network. UPMC is a 40-hospital integrated delivery and finance system with an integrated payer partner known as UPMC Health Plan. Allegheny Health Network is an 8-hospital medical system with a payer partner known as Highmark. Both health systems are widely known in Allegheny County and the larger western Pennsylvania area, and both offer programs to their members to prevent and manage disease. Specifically to address child asthma, both systems offer specialized pulmonologists to treat diagnosed children. UPMC has a children's hospital that also has a pediatric asthma center. The asthma center conducts research and prioritizes early detection and treatment of childhood asthma. Additional resources and assets for the community for this particular health priority include Breathe Pennsylvania, which provides educational programs around breathing concerns, with a specific program on pediatric asthma. The organization also focuses on indoor air quality by providing steps to improve home air quality. The final step in the MAP process is establishing goals to address the health priority. The recommendation for Allegheny County will include 3 parts: in-school tests for diagnosis, provide a short-acting inhaler for school use, and work with parents to understand the goals of care plan. School nurses have an annual assessment of the children and will utilize the asthma control test to determine a diagnosis when appropriate and provide a treatment plan. Also, every identified child in high-poverty schools will receive a short-acting rescue inhaler for school use. And finally, the nurse practitioner will ensure that an asthma action plan exists. If one does not exist, the nurse practitioner will write the plan with the consent of the parents. This plan should reduce the number of emergency department visits for children with asthma and reduce sick days from school. Upon review of this assessment's results, an additional creative goal was added to the step of the MAP process to encourage the use of community assets in addressing child asthma. The creative goal would be to partner with local organizations such as the Jewish Community Center to offer yoga for children with asthma. There are certain poses in yoga that offer asthma relief, and yoga as a whole teaches breathing techniques that can help to manage asthma symptoms. This creative goal would need further development with a community partner focus group and additional research. In conclusion, this 2019 Community Health Assessment for Allegheny County provided qualitative and quantitative data which helped to frame the justification for the community health priority of child asthma. The goals developed through the MAP process should address the Allegheny County's health priority and improve the health of the community. Thank you.